So welcome to Alverno, and maybe a little bit about who Alverno is. We are a very young company. We are celebrating our 25th year. We, as a company, focus on just laboratory testing, both in the clinical space and, of course, as we're talking about today, the anatomic space. When Alverno is looking for partners, such as Ibex, we look for companies that share our desire for innovation. And Ibex clearly is the leader of the pack in doing that. With AI reviewing kind of our slides, we eliminate that very, very small risk of a false positive. So for us, the notion of going digital with AI is just something we would do. It's about who we are. It's about delivering appropriate and great patient care to our patients. And we're really thrilled to have partners with Ibex to help us along in that journey.
So the types of technology that are employed in digital pathology workflow are slightly different to traditional pathology. We have 12 digital scanners from Philips that we use for our digital technology. Each one of these scans up to 72 slides, typically about a minute to a minute and a half for each slide, depending on the tissue type. And then we actually have to have our own server connected to all of these scanners so that we can provide the images to the pathologist. Just so samples are coming in, we're processing them here on our processing equipment. We're utilizing our staff to cut and embed, and then using the scanners to send those images back to pathologists. And now we're going to be using the Ibex AI algorithms with certain case types, prostate biopsy, breast biopsy, and gastric biopsy, in order to help increase the amount of workflow that we can do and make it more efficient for those pathologists reading those cases.
The exciting thing about this product is the incremental changes it's going to make in the way we do diagnosing prostate cancers. What we have today is a process which combines both human ingenuity and computer knowledge, such that these images are captured, quantified, and standardized in a way that humans can't. So the hope that I have and the excitement I have in dealing with this technology is this will help us better refine and define the actual diagnoses.
So cancer cases are becoming more complex in today's world, predominantly through treatments, which are patient-centered and patient-focused. So for the pathologist who's a part of that healthcare team, it's even more so important for an accurate diagnosis in order to tailor the treatment that is patient-specific. So the AI technology and platform is very beneficial to the diagnosis of especially cancer cases because it helps the pathologists focus in on areas of interest or areas suspicious for cancer or for malignancy. And it helps them make an accurate and quick diagnosis in order to get that information back to the clinicians who are taking care of the patients, and thus making treatment plans for those patients.
You know, when you think about patients, particularly in the space of anatomic path, when you're working with biopsies, is you get that biopsy and then you wait, and you wait. And that pain of waiting means you don't sleep that night. And if it's another night, you don't sleep that night. And so anything we can do to alleviate concern and get answers into patients' and clinicians' hands quicker, and actually get the correct answers with the highest possible quality, is what Alverno has always been about. Is once again speeding that result into the hands of clinicians and patients, eliminating those sleepless nights, and assuring that it is the highest possible quality result that any lab can deliver.